Most people think a crown protects the tooth, but what if it is hiding decay inside? If your crown tooth has a bad smell, it is not normal. Something is happening underneath. The first cause includes secondary caries. Decay can start under the crown where you cannot see. Such type of caries are called secondary caries. Second cause is open margin. If the crown is not properly sealed, bacteria can enter and cause infection and can create bad odor. Third cause is food lodgement. Food getting stuck around the crown leads to bacterial growth and bad smell. The fourth cause is gum infection. Swelling or bleeding gums near a crown is a clear warning sign of gum infection, and this can create bad smell. Let's know how the bad smell from the crown actually develops. Stage 1 includes perfect crown. In the beginning, a dental crown fits very precisely on the tooth. The margins are smooth and there is no space for the food and bacteria to enter. The gums around the crown also look healthy, pink and firm. At this stage, there is no smell or discomfort and everything appears completely normal. And the stage 2, over time, even a small change can create a tiny gap at the margins of the crown. This can happen due to wears or cement breakdown or improper fit. This gap is usually not visible to the patient and there is no pain at this stage, but this is where the problem actually begins. In the stage 3, food and bacteria entry, once a gap forms, food particles start getting trapped in this area. Bacteria naturally present in the mouth begins to collect and grow there. Since this area is difficult to clean properly, the accumulation increases day by day. Many patients notice food getting stuck, but they ignore it. Stage 4, hidden decay starts. As bacteria continue to stay in this area, they start damaging the tooth underneath the crown. This is called the secondary caries or hidden decay. The important point is the decay is not visible from outside, so the crown may look perfectly fine, but inside the tooth is slowly getting damaged. In the stage 5, the bacterial activity increases. As the bacterial activity increases, it produces foul smelling compound. This is what causes the bad smell from the crown tooth. At this stage, the patient may not feel pain, but the smell becomes noticeable. This is actually an early warning sign that something is wrong underneath. How to check this at home? The mirror check. First, you can check your crown usually in a mirror. Look closely at the area where the crown meets the gum. If you notice any discoloration, any dark lines, or foot getting struck repeatedly in the same area, then this is not normal and could be an early warning sign. And visual 2, floss smell test. In this test, use the dental floss around the crown tooth. After flossing, try to smell it. If you notice a strong, unpleasant odor from that area, it usually means bacteria are trapped under or around the crown. Visual 3 test is gum check. Thirdly, observe your gums around the crown. If you see redness, swelling, or bleeding while brushing, this is a clear sign of gum irritation or infection in that area. Fourth visual is taste awareness. Another important sign is persistent bad taste in your mouth. Even after brushing, if the taste keeps coming back from the same tooth, it indicates bacterial activity under the crown. Fifth visual is chewing sensitivity. And finally, pay attention while chewing. If you feel any discomfort, pressure, or pain while chewing on that side, your body is already giving you a warning signal. If you notice even one of these signs, it's better don't ignore it. Let's see what happens if you ignore it. Stage 1 is, in the beginning, the only sign may be bad smell from the crown tooth. There may be no pain, no visible damage, so many people ignore it, thinking it as a minor issue. But this is the early warning sign. Stage 2 is gum inflammation. Slowly, the gums around the crown begin to react. You may notice redness, slight swelling, or bleeding while brushing. This means the infection is no longer just under the crown. It is now affecting the surrounding gums. The stage 3, the decay underneath the crown continues to progress. Since it is hidden, you may not realize how much damage it is happening inside the tooth. Time symptoms appear, the decay is often already deep. Then the pain and sensitivity starts. You can feel the discomfort while chewing or sudden sharp pain. This usually indicates that the inner part of the tooth is now affected. Stage 5 is infection and tooth damage. If still ignored, the infection can spread further. leading to swelling, pus formation, and severe damage to the tooth structure. At this stage, saving the tooth becomes much more difficult. Stage 6 is tooth loss. In some cases, if the damage is too expensive, the tooth may need to be removed completely, and what started as just bad smell ends with tooth loss. And that's why it is important to act early before it reaches this stage. For this problem, when you visit a dentist, what will the dentist do? Let's find out. First, the dentist will clearly examine the crown tooth. The dentist will check the crown margins, the surrounding gums, and look for any signs of leakage, decay, or infection. The second step is X-ray. If required, an X-ray can be taken. This helps to detect any hidden decay under the crown, which cannot be seen from the outside. And third step is crown removal. If a problem is suspected, the crown may need to be removed. This allows the dentist to directly check the condition of the tooth underneath. And the step 4 is cleaning. If the decay is present, it will be cleaned and treated properly. Depending on the severity, the tooth may require a filling or root canal treatment. So the final step is new crown placement. After the treatment, a new crown is placed with proper fit and sealing so that the bacteria cannot enter again. So finally, the important thing to remember here is if the problem is detected early, the tooth can be saved. I share real dental warning signs. Follow for more, and please do like, share and comment on this video. Subscribe to my YouTube channel Dr. SmileCare. Keep smiling, take much care of yourself, and don't forget to subscribe.